Now to a new life-saving procedure for first responders, and it's already saving twice as many cardiac arrest patients in Western New York. 7 Eyewitness News reporter Josh Bazan tells us what's different and why it works.
Good afternoon, ma'am. What happened?
He just collapsed.
It can be a terrifying moment. A friend or loved one collapses. They're not breathing and they don't have a pulse.
Everybody's clear, everybody off.
In this simulation, AMR of Western New York shows a new technique they've been using for cardiac arrest patients called stay and work.
What Eric's doing is putting some patches on. He's going to work right around you, ma'am. Keep doing CPR and don't stop.
We focus on the CPR, and then we work everything else in around the CPR rather than displace the CPR by doing the things that we used to do.
Paramedics used to routinely follow a practice called scoop and run. They try to get a patient to the hospital as soon as possible and do CPR along the way. But as University at Buffalo professor Brian Clemency explains, getting a patient to the hospital faster doesn't always give them a better chance to survive.
I'm a doctor that works in an emergency department. I don't have much more to offer, if anything, than our paramedics on the street. By trying to move them prematurely to the ambulance or the hospital, we're robbing them of precious time where they could be getting CPR and getting the most critical of life-saving interventions.
AMR started the new approach in April, and since then, the number of people surviving cardiac arrests each month has doubled.
And what really fuels the concept is when you see the successes that we've had.
If you see a cardiac arrest, AMR says the first thing to do is call 911 and immediately start hands-only CPR. Those chest compressions while waiting for first responders to arrive are the most important step to saving a life. Josh Bazan, 7 Eyewitness News.